my name is Heather Lieberman. My student ID number is 3309588. I'm enrolled in Clinical Pathology 1, and my course number is VTHT222333431. And in this video, I'm going to be demonstrating doing a manual CBC. Alright, my name is Heather Lieberman. My student ID number is 3309. In this video, I'm going to demonstrate doing a jugular blood draw. So we want our patient in a sitting upright position, and I have my restrainer kind of holding his head up slightly, but still straight. So initially, I'm going to hold off in his thoracic inlet in here, and I'm just going to get familiar with his neck and kind of find out where that is. And see if we need to adjust any positioning, which I do feel it right here. So then I'm going to kind of cleanse that area. So I'm going to put some alcohol there. I'm going to wipe him down a little bit. And then I'm going to get ready. So I'm drawing in a lavender top EDTA tube. Since I will be doing a CBC, I need anticoagulated whole blood. So here we go. I'm going to get familiar again. I'm using a 20 gauge needle with a 6 ml syringe to get my sample. All right, we're flowing. Good job, Vader. Well, I lost it. So I'll take what I got. I got 2 mLs here about. I'm going to add that into my tube, which actually is about the perfect amount here. And I'm going to rock it back and forth gently, inverting it to mix that anticoagulant into the blood. All right, and there's my blood draw. Alright, my name is Heather Lieberman, and in this portion of my video, I'm going to be making the slide for my complete blood count. So to start, I kind of need some certain supplies. So I have my lavender top tube with the blood that I had collected from Vader. So I'll be using that. I'm just gently inverting it a little bit to kind of mix up my sample. I have 2 slides. One will be for the actual sample, and the other one will be for smearing the sample across that one. And then I'm going to use a wooden stick to apply my blood to the slide. So let's see, we're going to open it up. We're going to get a little drop of blood here. I'm going to dab that a little bit more. And the end there. Alright, so then I'm going to be holding this slide kind of at the top and bottom, however you'd like to say that, with my fingers, applying even pressure at about a 30-degree angle, and I'm going to come back at my blood droplet, and then I'm going to let it pool along this edge, and then I will be quickly and evenly pushing forward. So I'm going to come back, letting that pool, and pushing forward. So with this, what I'm ideally looking for is the feathered edge. So kind of up here, we have that little feathering, and just kind of behind that, right in there, is the monolayer. That will be where I'm actually looking under the microscope to do my CBC. Okay. All right, Heather Lieberman here again. So we're getting to the next portion of doing this stain, doing the stain. So we're going to do 3 different dippings, basically. The first one is a fixative. The second one is an eosin stain. So that one is going to be for the basic components of the cell, like hemoglobin. And then the third one is a blue one, which is methylene blue stain. And that is going to be the acidic components of the cell, like the white blood cell nuclei. So I'm going to put a little clip onto my slide here. We have different ones for each type of cytology we're doing, so we're going to use the one for blood today. So I'm going to start with the fix back here. Ideally, you want this to sit in there for about 60 seconds. So I'll start timing that. Also, prior to me doing this, I had let my slide dry. I did want my slide to dry completely before putting it in the fix, just so that the cells wouldn't come off of the slide. And then this is kind of adhering it before we're staining. So a little different. A few more seconds here. We'll be switching over to the second one here. So get that ready. Loosen my cap there. Alright, so now I'm going to just kind of tap her off here and switch her on over. Now for these two stains, I'm only going to leave them in for about 15 to 30 seconds. Stains can kind of vary on how long you'd want to put them in there, based on how long or how old they've been there. How thick your sample is might make you want to leave them in a little bit longer, or how dark you want your slide to be. Okay, so I think that's good. I'm going to cover that up real quick and get ready to switch over to the next one. Alright, we're going to switch on over. Alright, another 15 to 30 seconds on that one. And then I will be rinsing. From there I'm going to let it air dry again, and then we'll start moving on to the microscope. A few more seconds here. Get set up, so I'm going to set my slide almost kind of vertical on there just to help the water drip off. And we're good. So I'm going to give her a little light rinsing. And then we are set up to let you air dry. Alright, so now on to actually reading the slide under the microscope. So to start, I'm going to start on scanning. I'm going to have my microscope all the way down. We're just going to start right at the beginning here. So the area that I'm going to be focusing on is that monolayer just behind the feathered edge there. But we will get to that point. And initially, I'm going to try to set up just to be in that relative area, but we'll get there. So I'm going to use the coarse adjustment knob to get things more in focus here. Alright. So I got that here. I'm going to switch over to low power. Under low power, I'm going to be looking for any clumping of cells, any hemoparasites, anything that kind of looks abnormal that I might want to document. But I'm also using this to help get myself in focus before switching over to oil. I'm just using the fine adjustment knob on my low power objective lens. Alright, we're looking good. So now what I'm going to do is I'm going to kind of switch my objective lenses into this somewhat halfway state. I'm going to take a drop of immersion oil and place that on my slide. And then I'm going to put my oil lens into place. Okay, and then we're going to refocus. There we are. So I'm looking for fields that the cells aren't too stacked on top of each other, and they also aren't too spaced apart, and that is that monolayer I was talking about, and that is the ideal area to be. So let's get into that. I'm also going to be kind of focusing, or refocusing I should say, as I'm switching fields, as things can kind of go out of focus as you're moving around. Okay. So I think I'm at a good place right here. So what I'm going to start doing, are kind of a number of things. One of them is counting the leukocytes. So I'm looking for basophils, monocytes, lymphocytes, neutrophils, and eosinophils. So those are my 5 white blood cells that I'm going to be looking out for, and I'm going to count, or you would count 100 of them, okay? The percentage then you would get would be each number. So let's say I counted 70 neutrophils, my total number of neutrophils for the sample would be 70%, for example. So, you know, I'll kind of go through and kind of look around. For example, so in this particular field, I'm seeing 2 neutrophils. So I'll come over here. I'm assuming press that there, and we're going to keep going. I'll do another one here, and then we'll touch base about platelets. Actually, right there, that's looking like a lymphocyte. So we'll hit that. So for the platelets, to count those, I'm going to be doing 10 different fields. You're going to count the total number for each field, and then you're going to multiply that number by 20,000, and then that's going to give me my number of platelets for the sample. And then in regards to the erythrocytes, or the red blood cells, we're going to just be kind of paying attention to size, shape, and color. Okay, so those are those kind of things we would document. We don't necessarily count all of the red blood cells. That's what we would be doing with the PCV, actually. So this is the basics for doing the manual CBC. We'll move on. Oh, so also, before I forget, when you take that percentage that you get, so like I said, if you do 70 neutrophils, you're going to get 70% of your sample is neutrophils. That is just your relative value. So to get an absolute value, what you would need to do is have your total white blood cells. You can get that number from using a hemocytometer. You would take the percentage, multiply it by that number, and then that would give you your absolute value for lymphocytes. So you would have that, you would have your number of platelets, and then we're going to move forward and find our percentage of red blood cells. Okay. All right, so for the next portion here, we're going to do a packed cell volume. In this instance, the cells that we're packing are our red blood cells. Okay, so this is going to give us a percentage of the red blood cells in our sample. So to start, we're going to fill these little capillary microhematocrit tubes. They're plain, so no additives. Oh, and I'm going to shake them out here. We're going to do 2 of them. 1 for balancing, and 2, it's also good just to have kind of a backup. So I'm going to invert my sample a little bit here. Gently mix her. Ideally, we want to do 3/4 of the tube full. So I kind of just set the tube in here and let gravity start taking. There we go. Okay, so there's one. I'm going to pack it with some clay here. And then, I can ideally just set that in there. Alright, we'll do another one here. Yeah, it's kind of hard to see. Move my fingers out of the way a little bit. I can make a little bit less of a mess with this one. Okay, so I got that nice and packed on the bottom. So we have to use an adapter for our centrifuge to spin these down. The recommendations that come with it are to spin at 5,000 RPMs. for about 8 minutes. So we're going to get that loaded in here. And I already have that set right here, so we got our speed and our time. I'm double checking nothing else is in here. And just set these in as such, balancing that. Make sure we're running smoothly. All right, and we'll be back in 8 minutes. All right, so our samples have finished spinning, so we're going to take them out, and we're going to look over on our little grid here. That is going to give us our percentage. So let's take a look at what we got. So that one, not so good. This one, on the other hand, worked out pretty well. Okay, so this is what we're gearing for. The different layers in here, so we have all of our red blood cells right here, this packed. And it's kind of hard to see, but there's almost like a little grayish opaque disc right at the top of those blood cells. Okay, and that is our buffy coat. And that's kind of where our white blood cells are sitting. And then up here is all our plasma. Okay, so to get this percentage, we're going to use this little chart here. We're going to line up the bottom where the clay kind of stops and the red blood cells start. We're going to line that up here, and then our buffy coat is going to be at that top line. So we're scooting across. I'm thinking right there. And then to get the percentage, oops, of course we got to stabilize it a little better here. So our percentage is going to be kind of along this line. So you can kind of follow it out. These are in increments of 2. So I'm thinking we're right on this line. So we are about 48 is what I would estimate this to be at. Okay, so that's the percentage for the red blood cells. If you wanted to get an average or an approximate amount per microliter, you would take that percentage and divide it by 6. So now what I can do with this is find the total protein. So what I'm going to need for that is my refractometer. I do need to break this just above that buffy coat. I'm going to use some nail trimmers to help me kind of make a hopefully clean cut. So right here I'm noting the buffy coat, and I'm going to cut right above that. Okay, and this is what I'm going to put onto that prism. Very gently. If I can get more out, the better. Alright, so I kind of loaded that onto my prism. I'm going to close it and find some light. And I'm reading in the middle here, we have the measurements for the specific protein. It says SP here, total protein. And we are at about 7. Alright, so that's what I would record and give to my veterinarian alongside with all of the leukocyte count that I did, my percentage for my red blood cells, and then kind of any abnormalities that I've seen in any of the cells, and kind of take all of that information and pass that on to my veterinarian for my complete blood count.